Welcome to Chapter 2 on mental health issues. Hopefully, you're all having a great week. And this week, we're going to learn and talk a little bit about all kinds of mental health issues and break them down, talk about help, talk about suicide, depression, bipolar disorders, talk about the psychological makeup of a healthy psyche and how to get there, talk about some of the causes and effects of some of the mental and emotional and spiritual health issues that we face, and specifically the issues that you face as a college student. They can be really overwhelming because you face a number of issues that people in the real world, the outside world, don't see. You all have jobs, or it's more stressful even if you don't have a job. You have children or family or responsibilities. You have outside things that you need to do. You're playing a sport. You have college classes, which just by being in college means that you're spending extra money to be there and you're taking time away from family and work, which means you also have less money. So those are all factors that are really big issues in your mental health, as well as the concept of being in transition. I think the being in transition means that you're going from one place to the next, and that's why you're in college. You're trying to do something bigger, greater. You want more responsibilities, or you want more control at work, or you want your degree, or you want to go on to the next college. But all of those things create stress and pressure. And I think sometimes people will stop you and say, "Oh, I remember being in college. It was the best time of my life." And you're thinking, wow, that must have been a long time ago because it feels very stressful today. And it really does. So I'll talk about all of these learning objectives that you've got here on the page in front of you and understanding them and trying to go through treatments and so on. Mental disorders affect many Americans, a quarter of Americans over the age of 18, and in my opinion, I would say more. I kind of joke that it talks about during the college years in the slideshow, but for the college years for our college students come from all ages and all walks of life, and all of those ages and walks of life are stressful, regardless of when it is. But the first symptoms of panic disorders, bipolar disorders, obsessive compulsive disorders can begin as early as childhood and even in the late teens and 20s. And schizophrenia, most often the common onset for that is in the early to mid 30s as well. And many report being treated recently or diagnosed for depression, but unfortunately those numbers are less than half of the people that actually suffer with depression. And the third leading cause of death among young people, specifically 15 to 24, is suicide. The mental health and emotional health are both a part of psychological health. Mental health is a thinking component of psychological health, and it allows you to perceive reality accurately and respond rationally and effectively. I think we all know people that do not respond rationally or accurately to situations, and that would be a mental health issue. Emotional health, the subjective side of psychological health, is your feelings and your moods. This influences your social interaction and how others interact with you. And sometimes your feelings and your moods can also affect your mental health, which is accurately responding. Another one, spiritual health, is a sense of a connection to a larger purpose, coupled with a system of your core values that provide direction and your meaning in life. Many times we go through life and we forget that the journey is really what we're here for is this journey, is to pay attention to what we're doing on the journey. And sometimes we don't connect that with our core values and a larger purpose and a meaning in life. And we really do have to have that. This can include a foundation in your religion if that's what you choose, a connection to nature, people, causes, but whatever it is, there has to be some connection to what is your meaning in life. And I realize that's a really big question that sometimes we don't even think about. So the key is just looking at a lifelong personal quest for answers to questions like that. This area here, this slide I'm going to go through, looking at each of these characteristics contributing to your psychological health. Some huge ones on here. I just mentioned spirituality. I'll start on the bottom right. Feeling connected to something larger than yourself. That can really give you a sense and a concept of wholeness, where you feel like you've given your life to something greater than yourself, and everything is guided by that. The emotional intelligence, accurately perceiving, assessing, and regulating your emotions, is a really important aspect because emotional intelligence is called EQ, kind of like IQ, but your emotional intelligence. And this really is how well you are at not just assessing and regulating your emotions, but controlling those emotions. The communication and intimacy issue is expressing your thoughts and feelings to others and having close relationships. There's some statistics that show that years ago people had more close relationships than they do now. Because of things like Facebook and YouTube and Twitter and all of these ways that we connect with people that aren't true emotional intimacy. I do think there's a place for those things, of course. But when you look back and you reflect on the people that are closest to you, how many people do you think are the closest that you have? If you have one, two, or three, that's exceptional. If you have more than that, then you might be feeling a little bit more supported by the people around you. But as long as you've got a few people you feel comfortable and an emotional connection with, that's excellent. Being autonomous, which means being independent, and assertive means making informed, uncoerced decisions and indicating those desires to others. Are you a yes person? If somebody asked you something, will you say yes pretty much at all costs to yourself? Even if you're busy or it creates hardship for you, you wouldn't want to disappoint them or say no, so you would say yes. That really isn't being assertive and autonomous and thinking of yourself not as the center of the universe, but as an important person with decisions that clearly are important to you, and there are things that are important to you. I know people who would say yes to everything, and you can't lead your life feeling as if you have no authority to be able to say no to protect your personal rights in your space. The next one is optimism, which is interpreting life's events positively. I know people, for example, my father-in-law, if I were to say I won the lottery and we're all millionaires, he'd say, well, the government's going to take half of that. So there would be no positivity in any possible outcome for that. And we all know people that are just truly pessimist. And when we look at and we think back to being an Eeyore or a Tigger in life, are you the Tigger or are you the Eeyore? Self-esteem is holding a positive self-regard. And in some cases, we've been told for years and years and years that we're not good enough, we're not fast enough, we're not strong enough, we're not smart enough to be or do whatever we're doing. And self-esteem is looking inside ourselves and saying, do I have the possibility to do something? What do I think of myself? Do I hold myself in a positive regard? If you have insecurity where you walk into a room and you feel like the ugliest, tallest, shortest, thinnest, fattest, dumbest person in the room, that's a perception of yourself that I guarantee no one else has about you. So self-esteem is looking at that and thinking and reflecting, how can I think more positively about myself? And one of the ways I think of that is think to yourself of the people that love you the most. And if you could, instead of thinking of yourself what you think about yourself, think about what they think of you. And that really is positive. The realism is perceiving life as it really is, instead of kind of what you would really like it to be. For example, people that are in marriages sometimes read romance novels and think, I wish my marriage was like a romance novel. Well, don't we all? But that's not really reality. So when you start to think about being a realist, it's looking at the situations the best way you can without putting a lens on them that doesn't exist. And then lastly, prioritizing your needs to take care of your psychological and physiological health in accordance with their urgencies. This next slide is a really big picture, this Maslow's hierarchy of needs. I guarantee on your quiz there's a question from this as well. But the first one is at the very bottom, the biggest one that every person needs. These are the human psychological needs that we have. And the first one at the bottom is your physiological needs are most basic. You need food, water, shelter, sleep, sex, and to breathe. Breathing is always a good thing. And then from there it goes up. Once you've got those met, then you can go to safety and security, protection from harm by others and surroundings. Then love and belonging, giving and receiving love, and a feeling of sense of belonging with others. Once you've achieved all of these things, you can move to self-esteem, which is respecting yourself and being respected in return. And the highest of Maslow's hierarchy of needs is the self-actualization, which is truly fulfilling and understanding your potential, self-actualizing. And that's the key of where we'd all like to be with our mental health. Spirituality is the values and the internal guidelines used to make decisions, help you form your opinions, and ultimately guide your behavior. What are your values? I remember being a youth and being at Walmart when I was maybe 12 years old with a girl who I was with who had plenty of money, but she decided to steal a lipstick. And I remember thinking that was very weird because my mother would have killed me if I ever did this. But first of all, it just wasn't something I would have ever thought of. We had different values, or maybe she was looking for attention or whatever it is. But sometimes there are choices that are made and you start to realize someone has different values than you. One of the mistakes we make in relationships is assuming everyone thinks the same way that we do, and that's not necessarily true, as we know. And spending time focusing on larger forces you perceive to be at work in your life with meditation and prayer, and recognizing things in your life that you're very grateful for, and being altruistic means doing things not because they serve you, but because you're truly interested in helping someone else. How do we handle these common psychological problems? And what are the things that we can do to the challenges that we have that are basic issues like shyness, loneliness, anger, and bad mood? The first one is the feeling of apprehension and intimidation in social situations. When you come in contact, especially with new people. Shy people want to be social, but many times are held back because of feelings of maybe insecurities of self-consciousness, embarrassment, a negative self-image, not feeling confident. And it can be a reaction to a specific situation or more general. And intense shyness can be a social anxiety disorder, which we'll talk about a little later. And unfortunately, with shyness, many times we think things that other people don't see or think about us. And I've heard this so many times from so many students. They feel uncomfortable, especially if I were to say, let's do a presentation in front of the class. Some students I've had, and I've actually had this happen, I've had 3 students pass out while they were presenting. It's terrifying. Terrifying to me as the instructor. I can only imagine this poor student. And we know that when we look at and think about presenting as the number 1 fear in life, and oddly, the number 2 fear in life is death. So, it really makes a difference in our anxiety level if we are feeling shy. If we are feeling shy, looking at the root of why we feel that way. What are we telling ourselves? What is our self-image? Why do we have that mental model of ourselves? And where did that come from? Being lonely is lacking significant connections with others. And this can definitely be tied to higher levels of depression and general health problems. Take advantage of social opportunities offered, whether they're through sports or the church or through neighbors, or focusing on activities of things that are really of interest to you, and expressing yourself openly and honestly can encourage connections with other people. And this can be so difficult because, especially if you're used to being lonely, it can be hard to branch out to others, and that can create a sense of shyness. Anger is another healthy and normal human emotion. When we get to stress, we'll talk about anger and fear and how to manage those issues. But for now, looking at recognizing the triggers that help you clarify your values and assert yourself when you're angry, but not to express anger in a way that is damaging to relationships or that argues about everything in the kitchen sink, and that really kind of escalates the anger to release your emotions and can be very destructive. And that can be damaging to relationships, it can be damaging to jobs, school, your health, because it really does affect your body, raising your tension and your stress. Bad moods everybody has. Moods are prolonged states that you can shape your view of the world for hours or days at a time. But do you ever notice some people stub their toe and get a parking ticket on campus and they're in the bad mood the rest of the day? And then you run into people who have serious, serious complications. Living with someone who has cancer, maybe losing their home, has run out of gas, all of these things. And they seem to have a much more positive outlook. And you can't change what's upset you. You can only change your response to it. As Socrates once said, there's a famous saying that says, you should not worry about the things you can control, and you should not worry about the things you can't control. Because if you can't control them, they're out of your control, and there's no point in worrying. If you can control them, do something positive about them. The next one is act and don't stew. Sometimes we keep it inside and think it'll go away. Instead, be assertive, confident, but not aggressive. And if you can't change one thing, change something else. In our next area, we want to talk about mental disorders and how those mental disorders kind of affect us and what we can do about them as well. And this is a significant chunk of this PowerPoint, but I think it's really important. To me, this is the most important chunk of the entire course. Significant behavioral and psychological disorders that disrupt our thoughts and feelings, and they impair our ability to function. I think most of us will suffer with one of these at some point in our life, or we will live with someone who does suffer. And to understand it is critical, so that way we can understand how either we're affected or they're affected. And many people suffer from more than one disorder at a time. And I think a lot of times we underestimate that these disorders started as early as sometimes youth or even early adolescence and being a teenager. I had to break for a sip of my coffee. Back to mental disorders. Some of the causes of mental disorders include past or current experiences, extreme stress, illness, trauma. They can be triggered by chemical imbalances, many times genetic predisposition, or alcohol and drug use as well. And depression is the one I begin with because it's the most commonly characterized one with sadness. But there's something temporary and in a reaction to an event or loss. But a depressive disorder is usually characterized by profound long-term sadness or loss of interest that interferes with our daily life and normal functioning of all activities. And when I think about 8% of adults suffer from a depressive disorder every year, that number to me just seems grossly low, because I talk with so many students who are under such stressful situations or are going through such depression that to me the number would be much higher. And many times they can occur with anxiety disorders and even substance abuse. And it makes perfect sense why, if you think about it. When you're trying to dull or numb the pain without using antidepressants or seeking help, many times we can seek substance abuse through drugs or alcohol or prescription pills or whatever it is to try and escape. But in the end, that doesn't make things better. It can make them much worse. Some of the symptoms: slowed down, lack of energy, meaningless, feeling empty, worthlessness, and in many cases, guilt. And that's actually associated with women, sometimes more than men. Social withdrawal and loss of interest in your school or work or any activities. Difficulty thinking and not only making decisions, but also in memory. Not being able to sleep or wanting to sleep all the time. Being restless, irritable, snapping at people around you, and sometimes even thoughts of death or suicide. The different types: the major depression, experiencing 5 or more of the symptoms I just mentioned, including depressed mood or loss of interest for at least a couple weeks straight. So this prevents your normal functioning and can interfere with all aspects of your life and relationships. And for people that have never gone through a depression, I think it's easy to say, why don't they just snap out of it? Why don't they just, come back around? I just don't get it. And until you've been in that situation and see from the inside out, it can be difficult to understand. Some of the causes and reasons tend to be complex. The genetics and learned behaviors can contribute to depression passing for generations of a family. The biochemical processes, the physical processes can affect your mood of your brain. So it's not something that we've created in our minds. It's actually the physical way that our mind can work. And external factors can also contribute or trigger this, like a traumatic event, like a death, grief, severe financial problems, stress, divorce, substance abuse, and so on. This is an interesting dichotomy. Depression in men and women. More women suffer from depression than men. But I also think there's a couple of reasons that go into that, and I'll talk about that. But the causes and symptoms vary between the sexes. And many times men go much more undiagnosed and much more self-medicated. Men turn to alcohol and drugs many times more than women do. And the causes and symptoms also vary. So if a man feels irritable, anxious, antisocial, those things would be considered, can also be considered depression. For many times we think of depression, we think of crying, sadness, loneliness, laying in bed, and those can be many more symptoms that are associated with women. And at the same rate of being associated until adolescence, and then after that things can change. Women's rates of major depressive disorder rise, and women are more likely to experience depression younger, longer, and with more reoccurrences, and much more association with a feeling of guilt. I've heard many women say that they are yes people. They will do everything they can for everyone else around them, but not for themselves. And when they have to say no or they can't, there's a significant feeling of guilt. And that feeling of guilt can translate to feelings of worry, translate into feelings of self-loss, and depressive disorders can also be associated with anxiety disorders and eating disorders as well. There's no scientific answer as to why there's a higher rate, but we assume things like hormonal changes, postpartum depressions, and so on, expectations of childcare, juggling professional careers, school, stress levels, and so on. There's also a higher rate of poverty for women and a higher rate of sexual abuse and abuse in general, and a lower socioeconomic status, and all of those things raise risk. The other thing I see is not just that women do suffer more, which they do, it's that men go diagnosed less. In our society, when we think about depression in men, we often consider that ignorantly as a weakness. It's not a weakness. It's a chemical imbalance in the brain. And with that being said, men are less likely to seek treatment because they see it, and people around them can oftentimes see it as a weakness, which is not at all true. It's underdiagnosed and undertreated, and it's not as great as it's reported as far as the disparity between men and women. And they will express it differently: irritability, fatigue, physical problems, and so on. And the feeling and kind of this concept of emotional health, that men should just suck it up. And I see this as from young children. We're at the park the other day and a little boy fell and he scraped up his knee. And the father kept telling him, be a man, stop crying, be a man, stop crying. And of course I had a lot to say about that. But the point is, many times men are taught from a young age to not cry, to suck it up, to be a man. And they're less likely to be able to go seek help, and they're more likely to self-medicate or engage in risky behavior. How do you treat depressive disorders? There's successful treatment outcomes in more than 80% of cases diagnosed. Unfortunately, less than half of the people actually seek treatment. Talk therapies and antidepressant medications can definitely help. Antidepressants work on normalizing the neurotransmitter serotonin, norepinephrine, or dopamine in the brain, depending on what is determined by your psychiatrist or psychologist to be able to work. Now, when we look at the most commonly prescribed ones, the SSRIs, They're not addictive, but stopping them abruptly can cause some withdrawal symptoms. And unfortunately, whenever you start a medication like this, it can take 4 to 6 to 8 weeks to work. And during that time, it can feel like nothing is happening. You're kind of standing still. That's a really bad feeling. And then it can also take anywhere from 4 to 7 medications. You might get it right on the first one, but it can take multiple medications before you've found the one that's right for you. And they all act in different ways. So if you do seek help and you start treatment, don't give up just because one did not work for you. And many times people stop taking the antidepressants when they start feeling better, and that can lead to an abrupt return of depressive feelings. Those are all things to talk to your psychologist or psychiatrist about. Bipolar disorder is a different mental disorder characterized by abnormally elevated mood, which can seem as mania. Mania is a strange word, though, because to me it would just seem more of like hyperactivity, enhanced mood, really excited, and then often alternating with really depressed episodes of normal mood in between. And this can also be known as manic depressive disorder. This can increase energy, decrease need for sleep, irritability, impulsive behavior, unrealistic benefits, poor judgments, and so on. And these can lead to aggression or psychotic symptoms, including delusion and hallucinations in very extreme cases. And these depressive episodes can lead to thoughts of suicide. Many times alcohol and drugs are abused with people with bipolar disorder because this creates a feeling of normalcy, but obviously that makes things much worse, and this can make a diagnosis difficult. Almost 6 million Americans are affected every year, and both men and women are equally affected, and all races, all ethnic groups, everybody's affected by this, and can develop in the late teens or early adult years, and half of cases starting before age 25. And likely genetic factors, external factors, and all of these things can contribute. And it can be a lifelong condition, but treatment can be very effective for this. Untreated, the disorder can even worsen over time, so seeking treatment is of utmost importance. I know one I've recently added to the PowerPoints is attention disorders, because I'm seeing this so significantly with so many students and so many people I meet, and characterized with the problem of mental focus. And I think a lot of times we think that can be something that's kind of created, but it's not. And we also think of something like attention deficit hyperactivity disorder, ADHD or ADD, as something that happens to children. Well, those children become adults, and the symptoms don't go away. It's a type of characterized by inattention, hyperactive behavior, fidgeting, tendency towards impulsive behavior. You might also be doodlers, or trying to keep yourself busy, or finger tappers, and this can be creating additional problems and includes forming social connections and durable friendships, making things very difficult. Who has these? 9% of children and teenagers. Boys are twice as likely as girls to be diagnosed. And many times we notice a difference as well as boys and girls in learning styles. And just because a boy is finger tapping, doesn't want to sit in the desk, doesn't want to focus in the same way that a little girl might sit and be attentive, doesn't mean that they're learning. There's been recently studies that have shown that even if boys are moving or not sitting still or doodling, that they're retaining just as much information, because that's actually activating the creative side of their brain. So that's excellent news to hear. But upwards of 60% of cases continue into adulthood. And many times these can also couple with other mental disorders. Behavioral and cognitive therapies help, as well as prescription medications. And these stimulants have the opposite effect on people with ADHD. So if you're not ADHD, they would be a stimulant. If you are ADHD, something like a Ritalin or Adderall would not be a stimulant. There's also new ones that are out that are non-stimulant medications, and they can be time-released throughout the day, and they do not have the stimulant effects at all that Adderall or Ritalin have. Anxiety disorders, I think, is something that many of us suffer with. If I were to say to everybody right now, raise your hand if you suffer with anxiety at times or another, or if you feel your chest pounding or your heart palpitating, and those things are very serious and very real, and it's a category of mental disorders. Persistent feelings of fear, dread, and worry. And sometimes you feel like your situation is never going to improve. And many times we worry about those things we just can't change, and we worry about things that we can, but that aren't going our way. And many of us suffer from this anxiety disorder. This, to me, would be one of the biggest ones, and can be not only coupled with depressive disorder or substance abuse, because that can dull the pain, but it can also make things much worse. Generalized anxiety disorder, GAD, is chronic worry and pessimism about everyday events that last at least 6 months, and may be accompanied by physical symptoms. You may feel tired, headache, muscle ache, nausea, heart pounding, and it strikes about twice as many women as men. Panic attacks and panic disorders, episodes of sudden terror that strike without warning. This might be, for example, if I were to say stand up and present, or you're going to go in and quit your job, or something that would generally cause a severe reaction can cause it even worse as far as a panic attack. Chest pain, shortness of breath, you could even pass out. Generally will go away on their own. That's not going to kill you, although your heart pounding may feel like it is. And many people can have one and never have another, but some people have them recurring, which is panic disorder and the fear of a panic attack occurring. And there's actually medications and cognitive and behavioral therapy that can help with that. Social anxiety disorder is an intense fear of being judged by others and being humiliated by your own actions. I think we all have this on some level, but the physical symptoms can include sweating, blushing, heart rate. The same things if I were to ask you to stand up and present in front of your class. I think we worry about the fear of judgment of others, and that would stop us from being successful in some cases. But it may only occur in certain situations and not all the time. And men and women are equally likely to be one of the people that suffer from it. When anger becomes a part of the disorder, clinical shyness can occur, which may be a factor in some episodes of violence in social environments. Signs and treatments of social anxiety disorder. Some people may self-medicate, which means drugs or alcohol and all these other ways, food even. And those things are all negative because obviously they're going to compound the problem, make it worse, and they also disrupt the way your brain functions in a worse way for the disorder. Indications of social anxiety disorder include stopping social engagements, avoidance of activities, pessimism, low self-esteem, computer use instead of contact with other people, and the treatments definitely include professional help, psychotherapy, and some medications. We've all seen phobias. We've seen people on TV that have extreme, disabling, irrational fears of something, or maybe you have irrational fears of something, like closed spaces, or you might have a fear of dogs, or whatever it is. Most common types of anxiety disorders are phobias. And this can often occur from childhood and adolescence as well, and women are more likely than men. African Americans are twice as likely as Caucasians, which is a very strange one to me. I don't get that, but to suffer from a phobia. So there are so many phobias that people have, and they can be from something as simple as a spider to something as germs. You've all seen people that do not want to touch each other's hands, that are washing their hands until their fingertips are bleeding because of phobias and so on. Obsessive compulsive disorder is this sense of repeated and unwanted thoughts that lead to rituals in an attempt to control anxiety. Now, the obsession and the compulsion are two different things. The obsession is the thought that you have to do it. The compulsion is actually doing it. So if I were to say, for example, the person that when you leave the house, some of us have mild forms of it, and we think we left the curling iron on, or we didn't lock the door. So then sometimes we might go back and check. An obsessive person would go back 100 times. Or a person is obsessed about germs and thinks their hands are dirty. The compulsion is washing them until they are raw. And the rituals that they do, like the washing them, provide brief relief but can end up controlling your lives. And this can be a very dangerous one for people suffering, and many times medication can help and behavioral cognitive therapy as well, but it is very difficult to suffer through. Post-traumatic stress disorder is essentially this recurrent fear, anger, and depression occurring after any traumatic event. And some of the big ones we see, we have a large population of students that are returning veterans. And although they've gone through an incredible service for our country, they've also come back and had some incredible experiences that are probably difficult to live through and to be able to mentally work through. Seeing things that you've seen at work can be incredible and can create this post-traumatic stress response. And that stress response can be very difficult. I know the counselors on campus as well are also trained in working with veterans and can have outreach services for students that are veterans as well to be able to contact them, as well as reaching out into the community. Child abuse victims, rape victims, natural disaster victims, being in an auto accident, or the victim of any violent crime. And many times PTSD can people can startle easily, feel numb or empty emotionally, can become irritable or violent, and things can trigger the feelings that they had during the traumatic events, reliving trauma in flashbacks or in dreams. And because of this, can avoid certain places or experience and can tend to isolate themselves. Who has it? Pretty much anyone can have it, of all the categories of people that I mentioned. And children and adults experience PTSD, and many times women more so than men, but that might be because women are more likely the abused in an abusive situation or a sexual abusive situation. And they increase depending on how long the trauma was, the event lasted, the severity of the event, how close to the event the person was, and the experience of the injury, how in control the person felt of the events that occurred, and help or support the victim received after the event. Treatment for anxiety disorders. Cognitive and behavioral therapies can help people recognize and redirect the anxiety producing thought patterns. And this encourages people to face their fears head on and be able to change and rationalize those fears into a different thought process. The next one I would like to discuss is schizophrenia. Schizophrenia is the most common type of psychotic disorder, and it's marked by abnormal thinking and detachment from reality, which is actually not the same as when someone has a multiple personality disorder. And sometimes we think of them as the same. They're not the same. It cannot be cured, but it can be treated. The hard part is getting someone with schizophrenia to be able to take their medications can be very difficult. And many times people say that with schizophrenia, you're not likely to recognize that you have schizophrenic issues and you don't want to take your medication because it makes you feel like you're not yourself, which can be true, but it's the only helpful way for someone with schizophrenia. A detachment from reality with primary symptoms including delusions, hallucinations, thought and movement disorders, and inappropriate emotions. And men can show symptoms as early as late teens, early 20s, and women on average about 35 years old. Everybody's affected equally. The last, but obviously most important category that we could talk about with disorders, including all the disorders leading up to this, could be suicide and self-injury. And I think self-injury is one of the things that we don't talk enough about, but that many people have suffered through or known someone who's suffered through. And this can occur in the form of intentional self-inflicted cuts, burns, bruises, or other injuries without suicidal attempt. I actually had one student who told me something, and I'll never forget it. And she said that she felt such intense pain emotionally inside that the only way to relieve that pain was to harm herself physically. And she said she felt like that was a distraction from her pain, even though it was temporary. And that's why she did it. And that always stood out to me, and I'll never forget that young woman. They're often performed in an effort to deal with negative or overwhelming feelings and internal pain, and it can create a moment of calm from injury that's often followed by feelings of guilt or shame, and it can be a very big cycle. And many college students admit to performing some kind of self-injury in the past year, and people will often self-injure in places that you can't see. And the reliability of the statistics is questionable because most people conceal when they're suffering with something as significant as this. Begins or occurs in adolescence and during teen years, and it occurs with everybody across all sexes and ethnic groups. And many times this is something we only think of young women doing, but it really can happen with anyone. Therapy and medication can help people deal with difficult feelings in better ways. And at the end, I've got the link to the Palm Beach State College website for the counseling, which is free, and they offer 5 or 6 sessions. More than 32,000 people a year take their own lives, and at least another 8 unsuccessful attempts are made for each death that occurs. So those numbers are very significant. And the numbers are significant, and they're more likely for college students, more likely than the general population to attempt suicide. And it's the second leading cause of death on college campuses. Women attempt suicide more often than men, and men are more than 4 times as likely to actually die by suicide. One of the reasons may be because women attempt suicide with things like pills or cutting, and men attempt suicide with more violent means such as guns. And Native Americans and Alaskan Americans are the ethnic groups with the highest overall rates of suicide. And those rates among young African American teens and young adults have been increasing as well. Caucasian males over 85 have the highest suicide rate of any group in the U.S., which is an interesting statistic. The suicide risk is increased by several factors. Having diagnosed mental health or substance abuse problems is the biggest one. Financial problems, serious illness, loss of a loved one, family history of suicide, previous suicide attempts, access to guns in the home, and history of substance abuse. What are some of the warning signs? Many times we look back at people that we know that have committed suicide, and with the benefit of hindsight, we see things we didn't see that were there before. Statements that indirectly imply suicidal thoughts, the inability for someone to let go of their grief or worry or fear, changes in behavior and personality that focus on the hopeless, negative thoughts and feelings, and a noticeable downturn in mood within the first few weeks of starting new antidepressant medications can all be things that are warning signs. Loss of interest in everything, and loss of interest in spending time with people that they love. Expressions of self-hatred, excessive risk-taking, and disregard for their own appearance. Change in sleep patterns and eating habits, and a preoccupation with thoughts or themes of death. Most suicide attempts are expressions of extreme distress, and they're also related to many times depression, bipolar disorder, mental health disorders that we see. If you have a brain that's functioning and you say to yourself you could never imagine thinking of suicide, that there could never be a day forward that would be a better day for you, then you're not in the place of suicide that would bring someone to be able to do something like that. And in their perspective, they can't see a day that would be a better future. And for us as people around us, it's all we can do is try and recognize and look for those signs and symptoms and help the people and continually be persistent with helping those people, even though they'll do everything they can to push you away. Don't assume talk of suicide is just a result of a bad day or attention seeking. And if someone has had past suicide attempts, they're likely to have future suicide attempts. If you assume someone is suicidal, let them know you care and are available to help, and offer to call a crisis hotline together, go to a counseling center or the nearest emergency room, and continue to be persistent. I think the worst thing we could think of is in the future, if we are not persistent, the ultimate outcome. Here is the National Suicide Prevention Lifeline, and it's an excellent lifeline. I've called this myself with students, and they really are very helpful, and they have no agenda other than helping people that are suffering with suicidal thoughts. Thinking about what are some of the things you can do to feel more mentally and emotionally fulfilled. Basic tasks of daily life can feel overwhelming if you are under mental or emotional distress. Eat well, get good sleep, exercise, set good goals, seek company and support of people that love you. Most importantly, the professional help that's offered. Most campuses offer counseling. Our campus is no different. Palm Beach State College offers help. They really do. And there's an incredible counseling center. The people that work in the counseling center are incredible. They offer 5 or 6 sessions for free, and then they direct you to outside sources that will be able to help you for a longer term. And they offer for all types of issues. If you're having problems and stress of school, social, abuse, hospice needs, stress management, depression, PTSD. I've referred many people for all kinds of issues that they've suffered through, even breakups and going through depression, and everything at all that you need help with for free. They're wonderful, easy to talk to, and super helpful. And here's an active link that you can click on, or you can just type in counseling and at the Palm Beach State page, and it'll pull up there. Some of the different types of therapies that people go through that are helpful. Cognitive therapy focuses on your thoughts and beliefs and how they influence your mood and action. You work together with your therapist to identify negative thinking and replace it with positive thinking for treating depression and anxiety disorders, as well as helpful for bipolar disorder and schizophrenia. Types of therapies. Another type is behavioral therapy, which focuses on changing your learned behaviors. Once a behavior changes, then thoughts, feelings, attitudes, and moods will start to follow. And this includes exposure therapy, so being exposed to anxiety-provoking situations, pairing that with relaxation techniques to combat the issues and the thoughts that you're having with that. And aversion therapy, which is negative reinforcement, discouraging the unwanted behavior, and used for anxiety and attention disorder. Psychodynamic is founded on the idea that there are unconscious sources for a person's behavior, and patients and therapists explore unresolved conflicts buried in your unconscious mind, talk through the buried conflicts, understand them, and change how they affect you. It can take some time, but is used for depressive disorders as well. The types of therapy. Positive psychology focuses on increasing the psychological strengths and improving your happiness, aiming to highlight things like kindness, originality, humor, generosity, gratitude, all your best attributes. And the goal is to generate a more positive outlook and noting the number of good things that happens each day in your life. And this can help with all